Hey, it's Jessica DaMassa with WTF Health. What's the future health? We are talking to the who's who of health technology and innovation. And joining me today, we have the CEO of Quil Health. That's the joint venture, you might remember, from Independence Blue Cross and Comcast. This is Karina Edwards. Karina, thank you so much for joining us.
Thank you for having me. It's great to see you.
Well, it's great to see you too. You and I actually had a chance to catch up when you were relatively new in your job about a year ago. You were like 7 months in, and I'm dying to get an update. And in particular, I want to hear about how Quil is doing. I mean, you guys kind of inadvertently landed in your sweet spot with this pandemic. I mean, one of the things that, beyond the joint venture part of Quil, one of the things that was always really exciting was the fact that you guys were aiming to bring healthcare into the home by using the different devices that were available, including TVs, which I always thought was just a unique aspect of that ability to partner with Comcast. So tell me how things are going for you guys in the middle of this pandemic. I mean, and specifically, I want to know, what have you learned about health in the home now that everybody's kind of been forced to adopt it?
No, it's a great question. So it's been a wild ride. We literally started out and, when we saw each other last at the health conference last year in October, we were coming into Q4, we assigned new customers, we were totally focused on getting them live. We were seeing patients ramp on the platform, and then COVID hit and all elective procedures went offline. And we had one of those WTF moments. And we said, okay, what do we do? And literally our parent companies could not have been more supportive. So we actually had this focus on how do we help, right? There was misinformation nation, as Kevin Mahoney likes to say at Penn, and everybody didn't know how to handle the pandemic. So this was March 11th. I left this office, literally. And the whole company went virtual, and we said, what can we do to help? How do we help? So we leveraged the platform to bring the right information curated into the home. And literally 6 days later, in collaboration with NBC News and the Today Show, we launched a COVID-19 preparedness tool that we then got to every employee at Comcast, every employee at Independence Blue Cross, and they loved it. So then they launched it to their 1.3 million members. And so it really gave us, it gave us a purpose during the pandemic, and it just felt so good to be able to help. And then, come June, we had our clients come back online and procedures started again. And so now the business has leveled back out again, and we're seeing some great traction on the platform, amazing activation rates. We just completed the 3 go lives, and the patients that have gone through their procedures on the platform, 100% have said they felt better prepared and less anxious. And then we also got a clinical outcome study from our Penn Medicine partner, reduction in length of stay, increased discharge to home, reduction in readmission rates in the Quil cohort. So we are making some amazing progress, and the team is doing so well operating from home.
And you guys had focused initially on preparation for surgery. I remember talking to you quite a bit about that. And so when you're saying these improvements that you've managed to make have been related to those aspects of medicine, correct?
Correct. So yeah, we have many different types of journeys on the platform. One of them is a procedural journey. So whether it's a hip replacement or a bariatric surgery, that's one category. We have life events on the journey. So COVID being a huge life event, but pregnancy being a huge life event. So that's been great to see. Those are longer term, 9-month long tail journeys that are really more life enabled. And then we're starting to bring micro journeys to the platform to augment. So if you're going on a procedural journey and that you're a smoker or you're having some weight management challenges, we can put micro journeys in there to personalize the journey for you, to make sure that you have the next best action on how best to prepare and get to the healthiest version of yourself.
Okay, so let me pick your brain here on what's changed through COVID. Yeah. So, I mean, obviously, thank you so much for walking through how you guys actually changed, and pivoted what you were doing as well, creating this new COVID-19 solution to kind of help there. But I'm curious to know, what you have experienced in terms of, and you've got 2 different layers of customers or clients here. You've got, you go B2B to C. So I want to talk about the C part of it first. And I want to hear about what you guys have learned from consumers, as they have been watching these videos or engaging with your platform and all the different tools available on it. What have you learned about consumers through this, about how they really want their healthcare delivered in the home? I'm curious if there have been some new aha moments as a result of just, the volume of uptake, or just, the things that people are starting to, learn to turn to digital solutions for. What have you learned?
So preparedness right now is key, right? People were, I think, a little bit afraid to go back to a health institution or go into the doctor's office or go in to get a procedure. And so what we've seen is when you're invited into Quil and you get on board onto your journey, we're seeing the consumers now consume about 19 to 25, depending on the journey, 25% more information than they did in the past. So they're just hungry for knowledge, and they like getting that knowledge from a trusted source. We're also seeing they want to engage their support team, their caregiving circle, the people that like help them through these journeys. And so being able to invite them, getting them into the platform, giving them to-dos and assignments, it's been great to see them interact and really talk about how do I need to be supported during this health event and how do I get to the best outcome, but also having it prescribed by their doctor. You know, when we've launched to payers and providers, just transparently, right? I think people know that the point of trust is really that doctor.
Mm-hmm.
And so what we see is up to 94% activation of those people onto the platform, because they just, if the doctor says, I'm going to give you this tool to help you prepare, and you're going to track your progress and report back to me via the tool, they love it. They love doing it that way, and they love being able to consume the content where they want to, phone, web, TV.
Okay, I want to hear about the doctor in all of this, and also kind of behind the doctor, the healthcare institution, and then the payer. And you guys are in a unique position because of Independence Blue Cross being, behind you and supporting all of this. And so, tell me, I guess, a little bit about on the healthcare institution side of this. At that critical pivot point of the doctor, how has the uptake been with clinicians in terms of being, interested and eager in terms of prescribing this? And I know that you guys, one of your first clients, when I talked to you last, you were so cute. You had 2 clients, and one of them I remember was Penn Medicine, and you were you were integrated into the orthopedic team's care process there. And so I'm curious to know, like, how things have gone with the clinician, because I mean that is just such a pivotal point, not only for the patient, because like you said, it's a trust thing, but also for healthcare businesses, whether you're a startup with a solution or whether, it's the health plan or the hospital system, that's the point where the information needs to be conveyed, where, things like, reduced length of stay or, better outcomes for surgery, like that is the pivotal message point for that. So what did the clinicians think?
It's been great watching the clinical workflow, because we need to integrate. And so what we've done at both Penn and Rothman and our other provider clients, we've literally integrated into the clinical workflow. So when you're a patient and you get scheduled for whatever journey you're going to be on, you get a text message and an email automated from the electronic medical record, be it Epic or eClinicalWorks or Cerner. And then the patient knows it's prescribed by the doctor, right? They get it right there when they're leaving the office, so they can easily onboard. One of our clients, Rothman, they actually activate the patient in the waiting room. So when they come in, they hand them an iPad and they do their patient-reported outcomes and all of their intake forms right on Quil, right on the laptop. So now they're provisioned and they leave with a discharge care plan right there, personalized to them.
All right, and the doctors don't feel like this is just one more digital thing contributing to the burnout with the EMR and all of that?
It's actually what we're seeing an improved clinical efficiency, because it's integrated into their workflow, they used to have to go and call every single patient post-surgery. Now, if they see somebody's on track, they actually know who to reach out to. Those that are having problems, those that are off track, those that might have reported a pain scale of 7 or above. Let me proactively outreach to those populations, and let's make sure everybody else is tracking along. So it really is helping them focus their work, as well as maintaining a great relationship with the patient, because the patient gets nudges and check-ins from the provider organization. So it's a benefit for both.
All right. Now, I remember you saying to me that you guys, before, your business model was, like you said, B2B to C. And so it was the payer, or it was the healthcare organization that was paying for this. And then the patient was able to just consume it for free. Is that still how it's working, or has your model evolved?
So the Quil Engage platform is what we launched last April. And Quil Engage is still sold B2B to C. So we sell to Penn, to Rothman, to AmeriHealth Caritas, to IBC, to Comcast, right? So these are our—
Look at that client list growing.
So great. And so it's fun to be able to have that consumer experience, because for them, they're just navigating a journey. And if you think about just even the Philadelphia region, right? There's patients and consumers and members now on Quil on multiple journeys. So it's great because the platform, basically for me, Karina, the consumer, consolidates all the journeys I've been prescribed. So I can be on the IBC COVID preparedness toolkit and staying abreast of all of the COVID things that are going on, as well as getting my hip replaced or having a pregnancy, on those different apps. So now it's all one experience in all one app, customized to me.
All right, I want to hear about the new product that you guys announced a couple weeks ago. So this is focused on aging in the home. And I think that this is very timely and just, I think took, I'd be curious. This is something I know you talked to me about last year. Otherwise, I would think, oh my God, this is what we've learned from COVID is that, seniors are terrified of going into nursing home situations, but it's not that at all. You guys had the seeds for this a year ago. I know it. There's video to prove it. But so this is an aging in place idea. And it's Quil was the name of the product, I believe, right? Yep. And this was cool to me because it not only had like the standard, what I would say, like the Quil suite of technology services, so accessible on the TV and whatever, but you're integrating voice technology in this and then ambient sensors. And so I'm curious about this ambient sensor bit because I feel like I've heard this before from other companies, other health tech companies, and nobody's been able to really execute this at scale. You guys with your, released in every single Comcast cable package, you have a real potential here to make waves with this. So I'm curious to hear about the technology side of this offering. And then I want to talk about some of the more, the services that it provides.
So we started this because we knew that 50 million unpaid caregivers exist in this country, and they're really having a challenge navigating all the misinformation or what to do. And seniors don't want to leave their house, right? I mean, if you look at, I selfishly do use my family as great case studies. My dad's okay that I'm allowed to talk about them. I tell him I talk about them in public all the time. And, it's interesting. He doesn't want cameras. He doesn't want me checking in that way. But when we thought through, in partnership with some of the Comcast technologies and some of the R&D groups there, this notion of an ambient sensor, not a camera, something that could detect motion, that could detect and analyze patterns, that would know the difference between falling on the floor or laying in a bathtub, two very different things if you're in a bathroom. So being context aware, but never filming you. Right? Okay. It was just literally just ambient sensors that plug into your wall. They're little pucks that you plug into an outlet and they're just there. So no one's watching you. And then the voice hub, I think, when you start thinking about the care recipients, right? They want to be able to connect quickly. They don't want to fuss with technology. They don't want to where's the camera facing on the FaceTime? The whole thing where I literally talked to my parents the other day and I was looking at the outlet and I was like, Dad, move your head. See where the outlet is? Move your head to where there you are. Okay.
Right.
So they don't want to fuss with it. And so the nice thing is the way we've architected the solution is once you build your caregiver circle, Karina, my husband, etc., they can literally on the voice dial, they can pick a color. They can just pick green to go to me. And it calls me on my cell phone because the actual end unit is 4G enabled. So it's right there. It's a cellular connection. If they're savvy enough to plug it into the internet, great. But if not, it's already connected.
Okay, that's really cool. And then tell me about the caregiver side of this, because I think this is one of the, when I was reading the release on the product, this is one of the aspects of it that I think is really smart here, because this is where it's there's often that disconnect between you have the patient in the home, there's this monitoring, but then it's where does all this information that's being collected go? And if there is a caregiver involved, like there most often is with a senior, it's they want to be engaged, but there really isn't an easy way for them to do so. So tell me, I guess, a little bit about what prompted approaching it from this caregiver perspective and really building that into the design of the new product.
When we thought about this from a caregiver's perspective, I think there's two sides of this. The Quil Engage platform was actually already being used for caregivers. So when we signed AmeriHealth Caritas, they're a payer for Medicaid patients. And there's 187,000 patients in Philadelphia they care for. Getting their caregivers engaged actually gets such better outcomes. Mm-hmm. So we focused a caregiver journey, on having the tough discussions with the member, being able to think about how you don't get stressed out in a caregiver role, how to balance the pressures, but know the legal, the wishes, the desires of the member that you're caring for. So I think when we thought through that construct and had that great experience, going into this direct-to-consumer offering, we knew there had to be a what's in it for me on both sides. So the care recipient needed a bit of a journey to say, how do you ask for help? how do you not feel like a burden? How do you not feel like you're giving up control? And so teaching them the basics about being cared for. It sounds pretty basic, right? But, there's a lot, our parents and our loved ones are very, they're very independent, and they want to maintain that independence. And so also for the caregiver, how to start teeing up those conversations. What is an advanced directive? How do you talk about, your desired outcomes? Do you want to be in an assisted living facility one day? Do you want to live at home? What are your wishes? And make it come across in a way that's aligned with their goals. So that's how the notion came together. And we also knew that, it's better than the binder. If you talk to any caregiver, they have this huge binder. It's like, hold on, let me find dad's cardiologist. He's in here somewhere. And that cardiologist was gone 4 years ago, and it's crossed out 4 times. And what's the phone number? So being able to have one place where they can organize and navigate that information and hand it off. So if my brother or my sister or my cousin is going to step in for me while I need to attend to something else, then they have all the information and I can just share it with them.
Yeah, so much of the friction in healthcare is getting the right information shared to the right people involved. All right, so you're piloting this right now, I understand. Is that correct? But it's rolling out. The plan is to roll it out in 2021 at the end of the year.
Q3. So right now,
who are you piloting with?
So Comcast knows how to pilot technology, which is great. They're a great partner in that. And so what we do is we're following their tried and tested process. So we're actually going to have 100 pilot programs on the platform in December around the holidays. A great time to introduce this concept into to the home. And then we're going to follow that for the first quarter and learn a lot. Then we're going to add 500 people to the platform in Q2 to be able to scale it and start making sure that all the fun is worked out, all the bugs and all the quirks, because let's be clear, it's software, right? We all have to test all of these things. And then we're going to launch commercially in Q3. So we're thrilled at that scale and that launch, thinking about this as direct-to-consumer offering, working with Comcast and other retailers on how we actually would make this offering available to everybody.
All right, Karina, I got to ask, because, I think of you as the CEO of a health tech startup, but you're in a very special category with just by virtue of the fact that your startup is a JV between Independence Blue Cross and Comcast. And so I have to know, how does this work? I know they're on your board, but it's just how much of what you get to do. I remember talking a couple of years ago now with Don Mathis and Brian Lobley, who were the two guys from each organization who were spearheading this partnership. They were going to do it, and they're we want it to run on its own. So it's and I'm curious, I have to check in with you on this. Do you get to run on your own? And I'm sure, you just said, Comcast is helping you launch the pilot. Give us this, I just want to hear, how are they involved? Do you get cool, ideas about the market and innovation and where things are headed from them? Or how does that work?
So it's a great construct. It's interesting. We have a board made up. It's a 50-50 joint venture. So the board is made up of 3 folks from Independence and 3 folks from Comcast. And yes, Brian and Don are still on my board, which is great. And this was really their seed idea to be able to scale a healthcare tech company. The fun part for me is, though, we operate independently. So just like any traditional board, private equity, venture board, right, we have a strategic plan. There are strategic advisors, and they support us. And so, every month when I have board meetings, I have a scorecard that I'm held accountable to, and the team, but they have a scorecard. And it's awesome because when we ask for help, so for example, when we pivoted and had to launch COVID, right? When you think about the scale of that and getting out to 1.3 million members, that was done in 6 days. 5 or 6 days. It's so blurry. And over a weekend, I literally reached out to a CTO over at Comcast and said, hey, can I get 2 of your best AWS architects so we can help make sure we scale this thing right and it's ready to go? And they were like, absolutely. And they jumped in.
Oh my God, you know how lucky you are, right?
Right. Yeah. And so it's I still have a few employees that are seconded from organizations that help us. And so it's been a great partnership. And the nice thing is we're treated as one of theirs, which is wonderful. So you get some of the benefits, although I do joke around a little bit. I don't get cable for $5. I don't. I still pay my Comcast bill.
Hal Roker was involved in the Quil launch video. It was he's telling me about the new future of healthcare, and I was like, Hal Roker? You don't realize how much. Comcast is massive. Truly. So it's it is interesting that they're a force, and I have to rumor check with you on this too. So the other day I came across a story, it was in the Wall Street Journal, about Walmart partnering with Comcast to co-develop smart TVs. And the idea is that there's like the rev share for Walmart, they're going to be the distribution, but Comcast is going to help produce these TVs and then load it up with Comcast software. So is Quil going to be one of those things that's loaded on there? I mean, this is insane.
So the fun part for us is that right now on the Xfinity platform, which is the platform that will be integrated, we are native on the platform. So the Quil app is native on Xfinity. So if you have a box in your home today that's got Xfinity, great. There's also a new component they released called Flex. And Flex is like a Roku or a Chrome stick. And so we're also native on there. And so people can just say what happens next into their voice remote and pops up Quil.
Wow. I mean, the opportunity here is massive to just, you know, kind of help groom the next generation of healthcare consumers. I love it. Karina.
We think about this, sorry to cut you off there, but
no,
the one thing that I think is fun, home is the new frontier. All of us are living at home right now, and there's going to be very different ways to engage with people, right? So for example, people talk about the television. I don't see the television as the point for something like this, right? You're not going to video visit in your living room with your doctor. Probably not a good use of privacy, a good use of space, right? If possible. But you might, if you have a tough diagnosis, if you have a discussion, or if you're expecting a baby, right? You might want to get into your living room and watch some really, compelling content and have a care plan and have a plan of approach. So I think the TV is useful in those kind of ways, and it really rounds out the experience. And so that's where it's been fun being able to have that reach and scale.
You got my mind going with those sensors that you're plugging in. I think that's really an interesting thing. We need those 5G instead of 4, and then that's it. The sky is the limit. The future of health at home. I love it. Karina, thank you so much for catching us up on everything that's going on at Quil, and just also for weighing in with some of it's interesting to watch how your company is tackling healthcare in the home and which market segments you're focusing on. I think there is a lot to learn there, especially because of who you're backed by. I mean, they obviously see a great market opportunity there and an opportunity to make a difference. So thank you so much for stopping by and giving us an update.
Thank you for having me. Always great to see you.
Thank you. All right, Karina Edwards. So sorry, I don't know where I was for a minute there. Karina Edwards, she's the CEO of Quil. Thank you so much for joining us. I'm Jessica DaMassa. To check out more interviews with the top thinkers and leaders in health technology and healthcare innovation, please check out my YouTube channel. That is youtube.com/WTF Health. Thanks so much for watching. We'll see you guys soon.